Alrighty, so thank you guys for joining me this evening as we're going to be talking about how to guide your team in digital dentistry. So a little bit about our agenda. I'm just going to share a little bit about kind of my personal story with my team and, kind of journey into digital. We're going to talk a little bit more about team as a general concept, and then go through a couple cases and workflows of how you can utilize your team best to help things be more efficient and more profitable for your office utilizing digital technology. And then we'll end with some Q&A. So a little bit about me and my story. I did my dental training at UIC and then a residency at the Audie Murphy VA. And then after completing my residency program, I jumped immediately into private practice. I started out, I acquired a practice that had nothing digital at all, a really small space, green carpet, kind of everything a first practice should be. And then eventually I did a new build out, actually 5 years ago from yesterday, was when we opened the new build out. But I did a new build out with a lot more space and a lot more planning for different types of pieces of equipment and things like that. So that's my practice. I practice about 45 minutes outside of the city of Chicago in a town called Naperville. And just to kind of set the record straight, none of the digital workflows, none of this is stuff that I learned in school. So I was still film X-rays in school, never touched a scanner, and didn't even know how to bond on porcelain in school. So, I say that just to say that if it's new to you, it's certainly things that you can master. All of it was very new to me when I got out of school. So my journey into digital, it really started with my build out in 2019. The first thing that I incorporated was CBCT imaging. To me, that was kind of the no-brainer of I can't diagnose what I can't see. So that was really where I wanted to sort of start. And then like everybody's kind of 2020 era, we had the pandemic, we had a lot of kind of crazy stuff. And so when we came back from lockdown, we had just a crazy amount of patience and everything was kind of crazy. And so at that point I had one assistant, one admin, and one hygienist. And I decided to kind of jump into getting a scanner, and it just sort of made sense if I was going to get the scanner to get a mill. And so we started with that kind of when we got back from the pandemic, and it just grew overnight. And my team basically quadrupled, our production, doubled, and we just started kind of growing like gangbusters. So after our first scanner, we bought a second scanner a couple months later. The following summer, we started getting a little bit more into just kind of basics of 3D printing, models, surgical guides, night guards, things like that. And then after we started getting into a little bit more advanced types of design, like Plaid CAD Premium and ExoCAD, 5-axis milling, a little more lab grade type milling. I did a lot of digital courses through the Mod Institute, and then also started getting a little bit more in depth with the 3D printing, a little bit more advanced types of appliances, removable appliances, and things like that, and have just kind of continued from there. So I love digital. I love it because it's completely transformative. It helps us serve more patients, really effectively with comprehensive care, with greater precision, increasing the accuracy in what we do and optimizing our outcomes. It helps us really customize the experience for our patients, make sure that we're giving them the type of dentistry that we've discussed and that they're wanting. It helps us communicate both with our patients, with our team, with our lab, and it's also just super fun. So it's fun to really just create and innovate and be able to problem solve in ways that we never could before. And so I think that's really special. And then, my purpose, of course, and the why we all do this, right? It's patients like this who don't want to smile and just helping people feel confident again. So talking a little bit about cultivating culture and talking about the team. This is my personal team. So the one photo here on the left, that's actually us at Henry Schein Thrive Live, which is an awesome conference. If you haven't been, I would definitely go take your team. It is just an absolute blast. But this is my team. So I have currently 4 part-time hygienists, 1 admin, 2 full-time assistants, and then 1 assistant who's currently in hygiene school that still helps us out on Saturdays. So that is my little dream team powerhouse kind of team here, and all of them are really fluent in our digital workflows. They all scan our patients and have our digital workflows really ingrained in what they do. So I think it's really important to kind of talk about, winning because of your team versus despite your team, right? Your team is going to make or break you. So, you're going to win or lose because you have that culture and that group of people, and it shouldn't be, succeeding despite them, right? And I know sometimes it can feel that way. And certainly, as dentists, I think most of us probably underestimated kind of some of the leadership skills that we need to do what we do. When you're in dental school, it's really just about wanting to be this great technician and artist and have, these beautiful hand skills and really minister to people. And, I think a lot of us sometimes don't always realize the extent and the magnitude of what being a leader and being a manager in our office entails. And so, like a lot of you, I'm sure a lot of people feel like, hey, I really don't want to do that. That's not authentic to me, and it's really an uncomfortable place. But I think it's really important that we understand that although we may not want to do that, it may not be, what feels comfortable to us. We really have the responsibility of doing that if we have an office, if we have a team. And I think that this quote really nicely kind of sums it up, that to live as a doctor is to live so that one's life is bound up in others and in science and in the messy, complicated connection between the two. It's to live a life of responsibility. The question then is not whether one accepts the responsibility just by doing the work one has. The question is, having accepted the responsibility, how one does such work well. And so I think that that's a really poignant kind of point, that although we may not want the responsibility of leading a team, of cultivating culture and being responsible for it, we're really already taking on that responsibility. So how do we do that in a way that is authentic to ourselves? So talking about teamwork, creating and safeguarding that culture in your office, you are only as strong as your team. So you can be the Barry Sanders, you can be the best player on your team, but if everyone around you is not playing to the same level, you're never going to win that Super Bowl, right? So we have to be really intentional about how we're cultivating that culture and how we're safeguarding it. And so ways that we do that, one is communicating our values and hiring like-minded people. So it starts with who we're putting in our office. And I can tell you, I don't work in any magical unicorn land. I have the same pool of applicants that you all do. It's a challenge. We know that it's a challenge. But despite that challenge, we still have to be really thoughtful about what questions we ask and who we're permitting on our team. So making sure that we know what our values are and that we're hiring people that fit that mold, making sure that we're protecting the good teammates, that we're not tolerating people who are detracting from that mission and those values. Having it be really easy for our team is important, right? We want things to have systems, and we want people to show up and know what they're supposed to do and not have to, kind of guess at what's going to work or not work, right? We want to make it easy for them. We want to calibrate everyone regularly. Investing in our team, making sure that we're pouring back into them without expecting anything in return, right? And that can sometimes be a challenge as a practice owner or as a leader on the team, but it's really important that we're building our team members up, that we're investing in them and their education, that we're taking time to help them further their skill set. Providing feedback to our team, empowering them so that they can take ownership of their work and of what they do, of the technology, of the workflows, of the care that they're providing for the patients. Embracing fun. So one of the great things about digital is it is really fun. It opens up new avenues, again, to create and innovate. So really having that sort of creative aspect and letting the team have fun with it and try new things. And then practicing servant leadership. So again, when it comes to hiring, having value-based questions, so understanding what your values are, communicating those to applicants, and having value-based questions, asking people, what are your impression of our office's mission and values? Things like, what are 2 values you would add to our office's culture? Or even questions like, if you ran the office, would you change any of the values that you read? So again, getting to kind of the meat and bones of, we all know that we can teach anyone, any of the skills that we do in the office, right? We can teach digital, we can teach sterilization, we can teach seating patients, we can teach people how to assist. What we can't teach is, things like integrity and work ethic. And so really trying to understand and screen. I really found that the digital experts in our office and assistants that we worked with, they've been people that have interviewed at my office to answer a phone, and they've had that spark and they've had that ambition. And I've, seen that they're, looking for a career path and for new skills. And those have been some of the best people to mentor and that have really taken off and run with these types of workflows. So again, it starts at the hiring phase, but it also starts with you understanding what are your office's values and making sure that that's really clear to your team, right? It should be in your handbook. It should be reviewed at huddles and or team meetings, and understanding what is important to your team. Even doing something like a full value contract where you sit down with your team and you talk about those values and everybody sort of agrees that these are the parameters that we are going to work within in our relationship with one another. And it's really helpful because when conflict comes up or questions or anything, right, we always come back to our values. And there's one that in our office, my team knows that I say a lot, that I really love to lean into. And my favorite one that they hear a lot, especially when we introduce a new workflow or a new piece of technology or anything new, is look for ways to make new ideas work, not for reasons that they won't. And so that's an important value in our office, and that everyone on my team has to subscribe to, right? We don't want to sit there and complain and say, well, this seems hard, or I don't know how we're going to make it work, right? We're not going to find the reasons it won't. We're going to figure out, well, how can we actually make it work? And so it's understanding and kind of carving out that culture and those values that are really important to creating a good team dynamic. And then, of course, making sure that our team is trained. So we have a training checklist, right? And it starts at everything from the basics of how to seat a patient all the way down to kind of the end of it here of our more advanced types of workflows. And so our assistants can see, okay, check, 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 I've gotten the basics down, and they can feel that sense of accomplishment as they're getting closer to maybe some of the more advanced types of things that they're excited to learn. And there's accountability because we know, okay, who trained them, on what day did they get that training, right? And when did that trainee sign off that they felt really comfortable doing that? And so again, we're helping create a standardized kind of workflow and making it so it's really systematic for our assistants. They know what they're working towards. We know what skills we want to teach them, when we want to teach them, and we can say that it's been effectively communicated. And so again, having some type of system in place is really important, especially if it's written out in something that people can see. We also want to make it really easy. So this would be a picture of, it's actually our note template, but we utilize our note templates as checklists. So it's a note template. We're going to click through things and insert our progress note or our clinical note, but it's also, again, making sure that everyone's calibrated and doing things the same, right? So it says things like, the buccal bite captured all the teeth, that we didn't stop recording even when we saw the arches articulate together because we want more data to send to the lab, right? So it's guiding the assistant, it's guiding the hygienist, it's guiding whoever is doing this doing this workflow and seeing this patient in exactly what we want. They know that we need a quadrant scan, right? We don't need one teeth, we don't need two teeth, we don't need a full arch, we need a quadrant scan. And that what we're actually going to record, that we're going to record including tissues in the vestibules, that we want to get the interproximal contacts, right? So it's having those checklists or those progress notes or whatever it is for whatever we're working on, and making it really clear that whoever's doing that procedure, if they are getting pulled in 10 different directions, or it's a crazy day, or if it's maybe a less experienced assistant, they know exactly what they're doing and what's expected of them. And then investing in your team, right? So if you are on vacation and you're trying to figure out something for your assistant to do, having them make workflows, type out how do we do things, right? Start having people make manuals, have the information somewhere else than just relying on having it in people's brains, right? We want to have resources for people if someone new comes, if someone's out for, months and months on medical or whatever it is, right? We want to make sure that that information isn't safeguarded by an individual. We want it to be property of the office. And so investing in people, spending time, building them up to make manuals and instructions, and then investing in their training, right? You can take them to different courses. You can take them to things like Thrive Live or the Mod Institute, or there's even great online courses like the one that I have here from the Mod Institute. They have an online course that your assistants or your hygienists or whoever you want to learn these workflows, they can learn how to design a night guard or a denture or a crown. And so there's so many good resources out there. And once you start investing in your team and building them up and they get that confidence, they just continue running with it. And it's really pretty magical kind of how that synergistic relationship happens. It's like the more you start giving them, the more they want it, and the more you just want to keep feeding the interest. And it's a beautiful curiosity. And then, of course, we can always incentivize and empower our team so we can create different types of, systems and goals for them to hit. So it can be quantity based, like when you hit 100 crowns, Y happens, right? So we can do it based off of, every 5 night guards is X, right? We can do it based off quality. So when you do 3 perfect night guards, here's a reward. Or when you do 10 perfect fitting crowns, here's whatever it is, right? It can be based off of independence. So when you can successfully complete 10 crowns by yourself, Z, right? Or we can incentivize people based off speed, right? When you can complete a certain task in under a certain amount of time, or an appointment time, or design time, or lab time. So there's so many different ways of trying to incentivize people, and that reward could be something like a bonus, right? So every denture, every guard, or every crown, you get bonused whatever, right? When you scan for an ortho case completely by yourself. It can be increasing a wage. So this is something that I do for virtually every assistant that I hire in our office. Every assistant that gets hired in our office is typically hired at a lower wage than what they're asking for, with a map as to how they're going to get to the wage they're asking for or above that. So it's here's where we start you when you can successfully complete 3 crowns, perfect fitting crowns by yourself in under X amount of time. Here's your dollar raise there. When you can complete X number of guards, night guards by yourself in this amount of time, here's that extra increase. And so they can see when they get hired exactly where those increases come from, what skills they're going to learn, and how they're going to get to the wage that they want. And it incentivizes them, right, to continue to work, to try and master these skills, and to do really quality work and also work independently. It can be incentivizing people with the title, right? It can be becoming one of the digital experts in the office, mentoring other team members. It can be the lead assistant position, right? Or it can be additional opportunities, taking your assistants to courses or investing in them more, to become FDAs or to continue advancing their skill sets. So again, it's creating that culture and that opportunity for people to really just take ownership and shine, because what's beautiful about digital is that it does help us be more efficient and more accurate. But what we don't want to do is create more work for the doctor, right? It helps us be able to have our team really support the dentistry and support our patients, and for us to produce more quality dentistry. But the biggest thing that you'll find with your team is it's really about the clout and the confidence that will motivate them most of all. It's about having the patients come in and give them so much respect for the person that's designing their crown, or being able to troubleshoot a problem for them completely independent. And that is really exciting when you see these assistants just glow and feel incredible that these patients are really acknowledging their talent and their skill set. And it really becomes about mastering things and doing more for that type of recognition. And so it's things like this. It's the assistant feeling amazing that they can make beautiful fitting crowns, Or in this case, tooth number 8, which was an old PFM, and one of the assistants wanted to in-house match a single central and being able to make that patient feel really good about that match. Or even a case like this, an implant crown on number 5 that we milled in the office. It was a little lighter. So the assistant can say, you know what, let me get this perfect for you. I want to do a color corrective cycle. And this patient is so impressed. The assistant feels really good that they're, able to really, produce a great result for this patient. It's cases like this where this was actually a dentist that came in as an emergency. Her provisional came off of her implant, and the assistant completely independently, while I'm still seeing my full schedule, can handle this emergency. She can scan it, she can design it, she can mill it or print it, and we can, have this person leave with a temporary crown. Or even this case where it's a patient that comes in as a new patient for a COE appointment. He had an old veneer pop off, and he's a brand new patient to our office and he wants to get it addressed. And I have a full schedule. I don't have time for it, but someone else can at least get him, stabilized so he can leave and feel better about his mouth and come back for more definitive types of treatment. And so that's a 3D printed veneer that an assistant did, independently. And that garners a lot of gratitude from the patient, and they're excited about that. Or this is a completely assistant driven case as well, where the assistant is doing the temporaries for this case. And you can see she's videoing, she's making a little video of it. Don't touch resin with your bare hand, but she's touching it with her bare hand. She's excited, she's showing it off, and they can feel really good about the work that we're doing. We can be delegating work while we're producing dentistry elsewhere. And then this is that same case that was completely assistant driven as well. They designed the final zirconia. We milled it out of a puck on our Plan Mill 50S and inserted that for the patient. And so again, it just helps garner more independence, more ownership over the dentistry and the dental work, and it makes it more fun for the assistants, and it makes them want to come to work and continue working. We can also let them embrace the fun. So if you ever want to get free and easy social media content, tell your assistants, hey, while you're doing this stuff, take your phone out, make little videos. And so these are some that assistants have made. Level up, 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 level up. Oh, it sounds so yummy. Oh, it sounds so yummy. You want this yummy. I'll be up to level up, level up, level up, level up, level up.
What you call an icon living? Start a record label, Miss just did it. Whoa, nylon couple 5 minutes. Whoa, we are too hot in the business. Whoa, about to make a movie independent.
So if you ever want your team to love you, tell them they can have their phone out during the workday, making reels, and it'll help, give you content for your business. They have fun doing it, and then we can continue to show off the technology and what we do to other patients. And then talking a bit about servant leadership. So a servant leader shares power, puts the team first, helps people develop and perform as highly as possible. So servant leadership is really about honoring others before yourself, privileging people before tasks, inspiring vision, balancing focus with flexibility, always choosing ethics over profits, serving with humility, and making sure that you empower others. So there's a great little video clip. It's like 2 minutes. It's a Simon Sinek video called Be There for Each Other on YouTube that I would highly encourage you to play at Huddle tomorrow or your next team meeting. It's a great little video, but he talks about who is it that makes it through, the Navy SEALs audition, through BUDS, through the training camp. And it's not the smartest person. It's not the biggest athlete that makes it through. It's every single one of them that makes it through. When they are emotionally exhausted, when they are physically exhausted, some way, somehow they're able to dig down deep inside themselves to find the energy to help the person next to them. Service, giving to another, having their back is what makes the highest performing teams in the world. Not their strength or their intelligence, it's their willingness to be there for each other. And that's a really powerful message. And that's a really powerful culture. And when you start creating that culture with your team and in your office, that it's about having one another's back, that it's about serving one another, And most importantly, when you show that by your example and how you treat your team and how you set them up and serve them, it creates a really powerful dynamic. So, talking about a couple different examples here of some team-driven production, team-driven workflows. So one of them that is super straightforward, one of the easiest ways to start is with occlusal splints. So in our office, this is a completely assistant-driven workflow. It requires zero doctor time, so this is something an assistant can do in an operatory by themselves. The first step is getting full arch scans of the top and bottom, and then getting a bite. I like to do ours at open bites, so that's how my team is trained, but you can do it at a closed bite as well. The second step would be either designing it in the office, or if you don't have the design software or don't want to do that, you can outsource that part. And then the third would be being able to print the guard, or you can mill the guard in office. If you want to do duplicate guards or extra guards at the same time, it's very easy once you have the design, but that would be kind of the third step there. So in our office, we print Lucia jigs, and we also print quick splints. And so the quick splints, these are really awesome if you ever need like a really quick occlusal appliance for someone. You can take that, reline it with some bite registration, and it's really helpful at sometimes just getting someone who's in pain out of pain really quick. The other thing that it can help is someone who maybe doesn't understand why they need a night guard or how a night guard is going to reduce their pain. It's a really inexpensive, quick way of getting someone out of pain and also showing them that, hey, once this works, you need a professional night guard. And so those are things that we always kind of print and have on hand. And then our assistants will again take the full arch scans. That takes less than 5 minutes to take an upper and lower scan. And then we use those Lucia jigs to get an open bite and deprogram the patient. So they'll take a little compound, a little putty, bite reg, whatever they want, to use the Lucia jig to deprogram the patient and then get that scan of the bite at an open bite. And then you have your options, right? So you can design them in-house. There's free softwares that do this. There's paid softwares. It can be doctor, it can be assistant. It can be, I've got hygienists in my office that know how to do this. If there's a patient cancellation, they can do it. And you can learn that anywhere. So you can learn it on YouTube. You can learn it in the 3D printing and dentistry Facebook. You can take professional classes at places, again, like the Mod Institute. Or if you don't want to do any of that part of it, you can very, cheaply outsource it to someone. And so there's lots of digital designers, there's lots of ways that you can do that, and they can turn that around really quickly. So whatever makes sense for your flow is the best way to do it, but lots of options there. And so this is a occlusal guard. Again, we design them in office. It takes less than 5 minutes to do. So this is one designed by an assistant here. So we're mounting it on the virtual articulator. We're drawing the borders of the guard. And then we're just going to make it nice and smooth, make a nice flat plane appliance. We're going to make sure that we have equal bilateral posterior occlusion and that we have canine disclusion when we start working for excursives. We're making that guard transparent so we can see exactly where the contacts are going on what tooth. And then we're just working through our various motions and movements. And then if we want, we can actually put the patient's name on the guard if we're doing several of them at once, or if we want to put their name on it, we can do that as well. If we want to build an anterior ramp, we can. However we want to customize this, we can easily customize it. And once we get to the end there, we can print it, we can mill it. So we can mill that on a 5-axis mill out of an acrylic puck, or we can print it on a printer out of different types of resin. There's lots of incredible guard resins out there. Almost every printing company kind of has their own, and they're honestly all really good. It's kind of the perfect mix of that hard, soft type of material. And then because we have that guard designed, whether we've done it or we've outsourced it, it's super duper easy to duplicate guards if patients lose them, or do replacement guards. So one of the things that we'll offer is at the same time that we fabricate the first guard, we'll offer, it's one fee for that initial guard. And if someone wants a duplicate guard at the same time, it's so easy to do. We just charge $99 for a duplicate guard. So if they want 2 guards, they pay our $676 for the first guard, and they can get a second one for $99. We warranty our guards, so that's kind of our replacement guards. So what that means is we tell patients that if they come regularly every 6 months for their recare and they need a new guard down the road, we'll do a new guard at 50% of the original guard fee. And so that's building incentive, it's building patient loyalty, gives them reason to make sure they're maintaining their appointments, bringing their guards, letting us check it out. And again, just building, patient loyalty in doing that. But it's because it's so easy to do this workflow and to do this for patients. So of course, talking about kind of indirect restorations. So super easy workflow, right? Doctor time is numbing and prepping. And then after that, the assistant or a doctor can do tissue retraction, depending how you want to do that, whether that's with retraction paste or with cord, or just making sure your margins are high enough. And then the assistant can scan, design, and then again, print or mill, try it in, take a check x-ray, make sure it's perfect, etch, prime it, get it set up. So all doctor has to do is walk back in and insert. And so that's a really super efficient, easy workflow. Again, it really wows patients when it's the assistant doing all of that work. And it really builds the assistant up when the patient is really excited and looking over their shoulder and, oh my gosh, this is amazing that you're doing all of this. So this is just a really quick example of a same-day crown by one of our assistants. And then that can go right to our mill. It's beautiful in that we have so many different choices of if we want to puck mill, if we want to mill out of blocks, what types of materials we want to mill. So we can do zirconia, Emax, PMMA, an acrylic, whatever types of material. So whether it's a permanent restoration, a temporary restoration, if it's something where maybe we need to mill to open up a bite, whatever it is, we have so many different material options, which is really nice and makes things really affordable in the office. And then you can even mill your implant crowns. So you can work with a milling center, with a lab that can mill the abutment for you. And then you can always mill the crown, the implant crown in office, or they can design it and send you the STL, however you want to do that workflow. But again, it just makes it super duper customizable and makes it so we can be really precise and achieve the result that we want for our patient. So same day indirects, really super predictable and a really fun workflow to empower your team to do that they really will embrace. And then the last workflow that we're going to talk about is removable appliances. So one of my favorite workflows is doing interims for people who need them. So again, super easy, full arch scan, shade selection. You can design it in office, you can outsource it, and then being able to print and stain it. So one of the coolest things that I love to utilize this for is patients who have an emergency where maybe they come in and they have a tooth that's broken off or a tooth that needs to be extracted same day, and they can leave with a flipper in that same visit. So this next example is a patient who came in for an emergency exam and number 10 needed to be extracted. So one of the assistants scanned the patient while the treatment coordinator is working up the treatment plan and presented that to the patient. And then with a different assistant, I'm removing and grafting that site, while this other assistant who just scanned the patient is over at the computer designing a single tooth flipper, printing that. And when that patient leaves, and by the time we're done with the extraction and the graft and reviewing post-op instructions, we actually have a flipper that we can insert same day. So this is a little video showing that. So 10 is still there. So the assistant is actually going to virtually extract it while the other assistant and I are extracting it and then design this little flipper. This takes such a short amount of time to do. It's really easy. She can use the existing crown that was there to mimic what the tooth would look like. And we're done. So it's that easy. It can print. It'll take about 10 to 15 minutes to print, and then it gets post-processed and delivered to the patient before they leave. There's lots of different materials out there, but what's cool is based off how you design it, will kind of change some of the physical properties of the material, so how much it does or doesn't flex. So depending on how thin or thick you design things, so that's a really interesting kind of cool mechanical property to some of these materials. You can make them monolithic, so out of one material and then stain it to match when it needs to match. Or you can do a split file and print out of two different materials, a pink material and a tooth colored filling material or resin material. And then you can make kind of a two-piece, which is also really helpful as well, depending on what the indication is, how much time you have, and how long the patient's going to be utilizing it. So the big message is, embracing digital. It's such a powerful tool for your office and for your team to help evolve together. This is a quote I love. If you're not learning, then you're stagnant. If you're stagnant, then you're not evolving and the business isn't progressing. So I think it's super duper important to understand that you need to stop waiting to find your ideal team to implement digital. I think we oftentimes want to work backwards and we're waiting and we keep saying, well, we don't have enough people or we don't have the right people. And it's really the opposite way. It's once you start integrating this stuff, you'll cultivate those team members and that curiosity and people wanting to really excel. So it's important to get it, embrace it, and then start empowering your team to really take ownership of it. So thank you so much for your time on a late Tuesday. I really appreciate it. And we'll kind of open it up here to questions. And there's a little link at the bottom there for future webinars as well. Thank you.
Wow, thank you so much, Dr. Gantos. That was really fabulous, and we really appreciate those wonderful quotes, all geared toward building that digital dentistry and team. We are now open for questions, and we have some that have already arrived, so I'm going to get right into them. This one is from Dr. Don Falconio. Does the scan pattern matter when you are doing your full mouth scans or single unit scans?
Great question. It depends on the scanner. So some scanners are much more dependent on the scan pattern if you're going for speed in particular, but also just ease. And then some scanners and some softwares, you can like be waving that thing, jumping all around, and it knows exactly where you're at. So it's really dependent more so on the actual scanner that you're using. When you're doing like a single unit scan, scan pattern doesn't matter quite as much. You're not like scanning such a broad area. But typically when you're doing full arch scans, when you're really going for speed, depending on the scanner, it can make a difference.
Great. This question from Dr. Jen Mann. Is it cheaper to have all your digital equipment versus sending them to outside labs?
Um, yeah, so I think it probably depends on the quantity of what you're doing. For us, for me, we do pretty much everything in-house, and I can say from a profitability standpoint, it definitely made a difference in my office and continues to make a difference versus outsourcing. But I also think that when you're starting out, especially, there's nothing wrong with kind of dipping your toe in the pond. So one thing I would say is like when we first got a printer, we would outsource the guard design because it was just, okay, let's just master actually knowing how to print it and process it, right? But then once you start getting kind of the basics down, again, you keep wanting to sort of level up and your team will too. That's one of the things that was unexpected for me on the digital kind of workflow is how much it does really kind of create a really synergistic back and forth environment because the assistants will want to learn more and want to do more. And then you kind of have to learn more yourself and give them more to say, okay, like you're ready for the next thing. I don't even know what the next thing is. Let's figure out what's the next thing together. Right. But again, it creates a really great dynamic. And when we talk about team members who talking about turnover in our team and things like that, it creates a work environment that people want to be in, right? Assistants who get that kind of recognition from patients and that ownership and being able to create and do that kind of stuff, they're not going to want to go to an office where they're holding a suction again. So yeah.
That's a really good point. Thank you, Doctor. These other comments from Jen Mann. Dr. Gantos, I like your idea of servant leadership. Yes, and also TEAM, team, together everyone achieves more.
Oh, I love that. Thank you for sharing that.
And this question from Dr. Don Falconio, which system do you use more frequently, ExoCAD or PlanCAD Premium?
So great question. So PlaidCAD Premium is ExoCAD. It's Planmeca's version of it. So because I utilize Planmeca's scanners and their mills and CBCT, I only use PlaidCAD Premium, but it's the same thing. It's just white labeled ExoCAD.
Great, thank you.
My pleasure.
How much time would you say that you dedicate to education for the team? How much time in your workflow would you say any given
Yeah,
month?
I mean, so it definitely depends. So obviously when someone's newer to the office, there's a lot more of that sort of training period. And then once people sort of get more comfortable with the workflows, it's really just based off of their feedback. So one of the things that, especially at like the end of the year, I'll like to ask my team is, hey, where are you at? What do you want to learn next year? Like, what are you craving? What are your goals? And a lot of times it's, well, I feel really confident with this skill, but I really wish, I knew more about dentures or being able to do that more independently. I still feel like I get stuck doing that. Can you show me how to do that? Or even, again, like some of my hygienists, they'll say, hey, I would love to know how to, scan more efficiently. Okay, well, let's get, a scanning course for you, right? Or even my hygienist, have half of my hygienists love like designing crowns and night guards and things where they wanted to learn how to do that stuff. And it's great for me because if I have someone that's out sick or if I have, something else, I still have a team member that can jump in and get it done, or they have a cancellation, right? It's a really great use of their time. So again, I really try and kind of tailor it based off of the interest of who's there. I've had some assistants where they really gravitate more towards printing than they do milling. Okay, well, let's go further down that rabbit hole, right? And other team members who maybe love milling more than printing. And so it all kind of works its way out. And I just try to sort of accommodate and meet people where they're at. Oh, I think you're on mute.
Thank you. Sorry about that. Thank you so much. Thank you for that answer. That was the first thing. And secondly, we don't have any other questions. Are there any other frequently asked questions that you might want to address at this point?
That's a good question.
Mm.
I think the majority of the questions have been answered. Again, I really, I know I've kind of said this several times, but I really think the biggest misconception that I would hope to dispel is people thinking that you have to have the team first and then you invest in the technology. And it's really, truly the opposite. And I think that that can be kind of scary, right? Because it's a big investment, both financially and just in every way. But it's really a matter of once you have that and once you sort of collectively look at one another as a team and say, hey, let's figure out how to do this together, that's what really creates that beautiful environment, and you continue to grow with that. So I would just really challenge people to, be courageous and to really think creatively and not sort of limit ourselves and think small like we sometimes, do, and think that, oh, well, I can't do that yet. I don't have enough assistants. I don't have enough people that would know how to do that. Or, there's too many people always coming in and out. Nobody sticks around long enough for me to want to make that investment or want to invest in them. And you'll really see that that culture changes when you kind of flip it on its head like that.
Yeah, I love that. Really, really inspiring. Thank you so much, Dr. Gantos. That was a
Thank you.
wonderful presentation. And thank you all for joining us this evening. As I said earlier, we did record tonight's webinar and we'll email the recording out sometime in the next week. We would appreciate your feedback via our survey that will pop up on your screen shortly. Thank you all for joining us, and we look forward to seeing you on future webinars. Have a great night.